We've all heard the saying, you are what you eat. But in the case of aging populations, you also pay for what you eat, often quite literally. While leafy greens and legumes might not scream financial strategy, emerging research is making it increasingly clear. Diet quality is a powerful economic force in aging. And it's not just about your grocery bill. It's about how much you'll spend on medications, hospital stays, emergency room visits, and long-term care as the years tick on. In other words, your food choices today could determine your healthcare costs decades from now. And for societies already grappling with aging booms, that's no small potato. In large-scale studies, older adults with higher quality diets consistently show lower healthcare utilization and significantly reduced medical spending over time. We're not just talking about a few fewer aspirin bottles. We're talking about billions of dollars in system-wide savings, millions of hours not spent in waiting rooms, and legions of seniors staying mobile, independent, and out of the ER. And what separates those who cost the system less? It's not always luck or genetics, it's often diet. Let's look at some hard numbers. One of the most comprehensive analyses comes from the Nurses' Health Study and Health Professionals' Follow-up Study, which followed thousands of adults over decades. Participants with high adherence to healthy dietary patterns, like the Mediterranean Diet or Alternative Healthy Eating Index, AHEI, had not only lower rates of heart disease, diabetes, and cognitive decline, but also fewer hospitalizations, fewer surgeries, and lower medication use by the time they reached their 70s and 80s. These weren't just health wins, they were massive cost offsets. In fact, a 2022 study published in JAMA Network Open estimated that poor diet contributes to over $50 billion per year in direct healthcare costs among U.S. adults, most of which is concentrated in the older population. The culprits? Diets high in sodium, processed meats, added sugars, and low in fiber, whole grains, fruits, and vegetables. Heart disease, stroke, obesity-related complications, and type 2 diabetes, all heavily diet-influenced, account for the lion's share of these costs. Zooming in further, Medicare data paints an even starker picture. Older adults with diet-related chronic conditions incur $2,000 to $4,000 more per year in medical expenses compared to their healthier eating peers. That's not including the indirect costs, mobility aids, caregivers, assisted living facilities, lost independence, and even reduced quality of life, all of which compound into what economists call the burden of preventable aging. But the savings aren't just theoretical. In controlled trials, dietary interventions have led to real-world reductions in healthcare usage. For instance, in the PREDIMED study, older adults randomized to follow a Mediterranean diet had fewer cardiovascular events and, consequently, lower associated hospital and medication costs over just 5 years. That's not futuristic thinking. That's present-tense economics, driven by olives, legumes, and fish. Even small improvements in diet quality can yield big fiscal dividends. One analysis by Tufts University modeled what would happen if just 20% of older Americans modestly improved their diet. Think an extra serving of vegetables, fewer processed snacks, a little less red meat. The result? $20 billion in savings over 10 years, mostly from fewer hospital visits and diabetes-related complications. Not too shabby for what amounts to a little extra broccoli. Of course, cost savings aren't evenly distributed. Older adults in lower income or marginalized communities are more likely to suffer from diet-related illnesses, and they're also more likely to face food insecurity, lower health literacy, and less access to preventive care. This means that poor diet quality can function like a tax on the vulnerable, one paid not in dollars up front, but in pills, appointments, and lost autonomy. Addressing these inequities by improving access to nutritious food through subsidies, community gardens, or medically tailored meal programs isn't just socially ethical, it's economically smart. And let's not forget long-term care. Poor diet quality is a driver of frailty, cognitive decline, and loss of independence, the very things that land older adults in nursing homes or require round-the-clock care. The average cost of assisted living in the U.S. exceeds $50,000 per year, and those costs rise quickly with medical complexity. Every extra year of independence driven by better nutrition is a year of preserved dignity and saved resources. So, what does all this mean? Quite simply, healthy food isn't expensive, it's preventive medicine. Investing in dietary quality pays for itself many times over, not just in added life years, but in the form of lower premiums, fewer pills, shorter hospital stays, and better quality of life. Whether you're a policymaker eyeing Medicare's future or an aging adult trying to stretch your retirement dollars, what's on your plate today could make all the difference tomorrow. In short, diet quality isn't just about living longer, it's about aging with less financial drag. The best part? You don't need a PhD or a personal chef to cash in on the benefits. You just need to eat like your future depends on it, because, well, it does.